Evaluating education inequity and the influences of public policy as a social determinant of health access in low-income urban minority groups in the United States public school system, K through 12. This is presented by Aleixs, Sameera, and Suhaas. And today we'll dive into urban minority groups, socioeconomic influencers, and recommendations to end education inequity. Urban minority groups. Poverty and income has a tremendous impact on academic performance and education. Urban minority groups in low-income areas do not have access to as many materials or resources as a high-income area. According to Global Citizen, families living in poverty often have to choose between sending their child to school or providing other basic needs. Even if families do not have to pay tuition fees, school comes with the added cost of uniforms, books, supplies, and exam fees. Families in low-income areas have trouble with paying for school fees and basic needs. School fees make it tougher for families that already have a low income, and this affects education because some school services might not be able to be paid for. The loss of these services could affect academic performance and make it worse. Poverty also affects if a child goes to school or not. According to Children Incorporated, children from the poorest households are 3 times less likely to attend school than children from the richest households. Families in poverty may not have enough money to send their children to school. This would cause a cycle of poverty because education is a big factor of getting a higher income. Without education, the kids would also have a higher chance of being in poverty in the future. According to UNESCO, education promotes economic growth because it provides skills that increase employment opportunities and income. Nearly 60 million people could escape poverty if all adults had just 2 more years of schooling, and 420 million people could be lifted out of poverty if all adults completed secondary education. Education helps people come out of poverty. That is why it is necessary and important. Urban minority groups in low-income areas also have to worry about health risks. Families in poverty might not have access to health care, and this could cause worse health. According to AAFP, education typically leads to better jobs, more money, and many other benefits, including better health insurance, which leads to better access to quality health care. Access to health care improves health by a lot and reduces the health risks that low-income minority groups face. Emergency situations would also affect urban minority groups because they might not be able to pay for the damages or resources needed. Tornadoes, earthquakes, and other natural disasters would cause a lot of damage, and families in poverty would most likely not be able to pay for the damage. According to Red Nose Day, poor kids are more likely to miss school after a disaster, especially if their financial or family situation requires them to relocate frequently. This could lead to drastic effects on long-term achievement, like dropping out. A natural disaster would affect a low-income minority group the most because they will not have the resources to either evade the natural disaster or repair the damage done by it. By having their home destroyed, these families would take a while to recover, causing their children to miss school. This would cause a worse education, and this child would lose many opportunities in school. Areas in poverty would most likely have a weaker or outdated system to deal with natural disasters, and this would make it even harder for families in poverty. In the modern day, COVID-19 would be considered as an emergency situation, and COVID does affect urban minority groups in many ways. With schools being shut down, families would need to buy devices like computers to allow their child to go to school online. This could be a problem because families in poverty might not be able to afford all of these devices. This could cause education to become worse, and it would make it harder on the students without access to good devices or good internet connection. Another problem would be jobs shutting down, and without jobs, a family's poverty becomes even worse. This is a graph that shows that low-income students do not go to college as much as a high-income student would.
So this brings us to socioeconomic influencers. So before we dive into socioeconomic influences, Let's first define what socioeconomic status is. So according to the American Psychological Association, socioeconomic status is the social standing or class of an individual or group. It is often measured as a combination of education, income, and occupation. Examinations of socioeconomic status often reveals inequities in access to resources, plus issues related to privilege, power, and control. Socioeconomic status is also known as SES for short. Several SES factors can influence education inequality and healthcare access. Today, we're going to be focusing on the following SES influencers: education, income, social environment, healthcare, and policy. So education significantly contributes to opportunities, jobs, and potential income. It also provides a foundation for educated individuals to gain and understand health-based resources around them. Additionally, it's important to keep in mind that educational opportunities should be established early on because they can have lasting health effects throughout life. An example of an educational opportunity is Head Start programs. Another SES influencer is income. Research has shown that with higher income comes better healthcare, better insurance, better housing, better schooling, and lower mortality. When communities promote positive social ties, they improve trust, cohesion, and a sense of community. So having positive community ties along with a stable home and school environment are all important for improving socioeconomic status. This figure here, 31 million, shows the number of people currently uninsured in the United States, which brings us to our next topic of healthcare. Some quick points that link healthcare and socioeconomic status are that the majority of those with a high school education or less do not have health insurance. Also, 26.9% of those without a high school education do not have insurance versus 11.8% of the total population. The uninsured population were more likely to live below the poverty line. And if you would like a deeper dive into these health and population statistics, feel free to pause the presentation and look at this figure from the US Census Bureau. And lastly, we have public policy. So what is public policy? According to the Sycamore Institute, public policies can create, regulate, and maintain public goods that foster supportive environments for good health. Public policies can reduce barriers, create opportunities, or provide incentives that influence the choices that impact health. When taking policy into account as an SES influencer, it's important to consider that legislation can provide better funding for schools. They can create after-school programs and provide community services, while also bridging education and health gaps between students.
So now we're going to talk about the importance of advocacy. So advocacy is influencing public policy to support an idea based on educating others about the social issue. The education aspect helps build policy to be effective. It's also about responding to the impact in policies that affect people in certain communities. So the three parts of advocacy are grassroots organizing, coalition building, and legislative efforts. Grassroots organizing focuses on building power within the community where people come together to identify problems they share, also solutions to the problem, and identifying targets who can provide access. Lastly, the legislative efforts is the is the direct action to influence policy. So examples are to spread awareness of the issue by launching a petition, holding a press conference to build power, scheduling a legislative visit with an elected official, or writing a letter to the editor. So in a historical context of an example of advocacy is that the Black Panthers Party, a political focused organization that fought for racial justice, one of their efforts was to provide breakfast to help children stay focused and healthy because they were experiencing food insecurity. So the public really supported this effort, so therefore they pressured their political leaders to create their own school food program. So the USDA, which is United States Department of Agriculture, created a pilot program, and eventually it was authorized to become the school breakfast program. As you can see, advocacy makes a difference to influence public policy in holding elected officials accountable to make sure that they go through their issue platform. Now we're going to talk about policy recommendations to increase education equity.
Strength and Diversity Act. The Strength and Diversity Act is an act that helps diversify schools, and it also helps to stop segregation. This act attempts to make education more equal, and it was thought up by Marcia Fudge, and she said, more than 66 years after the landmark Brown versus Board of Education decision, America has yet to fulfill the promise of equity in education. Marcia Fudge hopes that this act will help close the education inequality gap. Marcia Fudge also says that the Strength and Diversity Act will provide resources to support districts across the country working to increase diversity in our schools. I am proud to have introduced the first bill addressing school segregation to pass the House in a generation. And passage of this bill takes us one step closer to realizing the spirit and letter of the Brown decision and eliminating institutional racism in America. This act will support districts in developing, implementing, or expanding diversity initiatives they already have in place. It will also establish public school choice zones, revise school boundaries, and expand equitable access to transportation for students. There are also many pros and cons to this act. One pro of this act is that it increases diversity in schools, and it helps poor urban minority groups have a chance of going to a wealthier school. This would help close the education inequality gap, and it would also help break the cycle of poverty by providing a better education. Another pro is that it helps students in low-income areas go to schools farther away. This would help children in low-income areas to get out and will improve education. Another pro is that this act provides materials for better teaching and better teachers. This will lead to better academic performance overall and will also lead to an increase of income in the future. One con of this act is that the bill has not been fully passed. The bill has been passed by the House of Representatives, but it still needs to be passed by the Senate. If the Senate does not pass this act, none of the pros will be put into effect. Another con is that an act like this would require a good amount of funding. Funding may be harder to get, and money is needed to accomplish everything that was previously mentioned.
So now we're going to talk about the second recommendation. So to help decrease education inequity, community partnership schools can be established. So community partnership schools is a model that involves partnership between a university or college, a nonprofit organization healthcare provider, and a school district to provide services related to counseling, mentoring, healthcare, and nutrition for students and families. The purpose is to address all aspects of the well-being of a child to improve their health, growth, and social development and education performance so they can be successful long-term. It's common for young students to experience stressors that can affect their education, whether that's occurring at home or school. So basically, community partnership schools is a one-stop shop for almost everything that can help support students and families in a way that's accessible. Recently, a House of Representative bill has been introduced to help schools receive support by their community. It's a similar system as the community partnership school, but this bill serves as a service grant program where funding will be provided to an education agency in which they will send funding to their local organization based on certain criteria. So this criteria is basically is showing that they have a track record that high quality services were successfully provided, being able to provide data report on annual basis, and of course, there will be an on-site coordinator would have to be hired to execute these plans and meet the needs and requirements. So that's when the organization directly assists schools with various services like mental health care, tutoring, and after-school programs. While this is a great bill, there are cons. So this bill only has a 4-year period that can award award funding. So therefore, it's basically a band-aid solution because service grants aren't always sustainable since there's possible that there will no longer be funding. Also, not all community-based organizations may fit the criteria. Therefore, not all schools may not be able to receive support. The bill may also help certain locations, which may be difficult to do outreach in large education districts, such as Miami-Dade County and New York City. So, in conclusion, the use of interdisciplinary lens is important. It's important. There's value in people from different disciplines and fields coming together to create a solution for a recurring social issue. Representation for medicine, local officials, education, social work, and community empowers people to continue to advocate for wellness education because of their encouragement coming from support. And with strong coalition groups and organizing efforts, public policy can be used as a tool to help schools and community to improve and strengthen their school system to be more diverse, inclusive, and accessible.